hello. Hello, good evening, everyone. My name is Dr. O, and welcome to Health Caring Differently, where we inspire diverse students to explore careers in healthcare. Please, I appreciate you tuning in tonight, but please tune in every Tuesday at 7 p.m. Eastern Time. And also, please follow us on all our social media platforms to stay in the loop, gain valuable resources, and hear more about our next streams. Now, I also encourage you to sign up for our newsletter. And that's because on the newsletter, we have information there on diversity pathway programs to medicine, scholarship, and research opportunities. So I want you to remember this episode is always for inspiration. Tune in for inspiration and then follow us through the newsletter so you can get the information. And you can get that through our website at healthcaringdifferently.com. Now, for tonight, I really hope you're going to drop your question for our guest in the chat, and I'll be sure to respond and to make sure that she gets your questions. So, our guest today is the Honorable Dr. Fleur-Delise Gigi Osler. She's an internationally renowned surgeon and a dedicated advocate for health and healthcare. Senator Osler has held leadership roles with several Canadian medical organizations, including co-chair of the Virtual Care Task Force, a collaboration between the Canadian Medical Association, the Royal College of Physicians and Surgeons of Canada, and the College of Family Physicians of Canada. She is the recipient of numerous honors and awards and was appointed to the Senate of Canada in September 2022. Welcome, Dr. Gigi Osler.
Hello, Dr. O.
Hello. Oh my goodness. Dr. Osler, I really am so excited to have you on this show. I mean, we have to talk about just like fire, like the fact that, I know you from your previous role as president of the Canadian Medical Association. And then I know that you are a surgeon. And then you now are, in Senate. Like, it's just amazing. And I appreciate you taking the time to be on Health Caring Differently.
Well, I'm delighted to be here, and you are such a force and an inspiration for many of us, myself included. And I remember years back when we would have these same conversations at conferences on the side of the table. And so you've elevated this conversation to an entirely new level, which I think is not only powerful, but very important, and very important to shift the needle on where I think we both believe the physician health workforce in Canada should look like and strive for.
Yes. And I think the two are very much intertwined. And that's the thinking behind Health Caring Differently. It's so that students can know that, like, if you're different, yourself reflected in either medicine or in different fields in healthcare, right? It could be various fields or in research. Then that's actually a beautiful thing. You can bring your experiences, your journey, your authentic self, and be the change that you want to see. But at the same time, I'm amplifying the people that I want folks to see as amazing examples. And, a lot of people might not be aware of the fact that folks who are of Filipino descent are underrepresented in medicine in Canada, I believe in the United States as well. So that's also part of why I wanted to have you here to kind of tell us, I'm going to start with the first question I have for all the guests.
Okay.
How are you health caring differently? How do you bring all of those things into the amazing leadership and medical work that you do and have done?
Well, of all your guests, I would imagine I'm probably health caring differently from all of your guests in terms of I, after 25 plus years in healthcare, am no longer health caring, and now am devoting my time 100% to my work here in the Senate of Canada. And so that career shift is a little bit different. At present in the Senate, we have, I I think we have about 6 physicians in the Senate right now. So certainly a nice cohort, along with a nurse practitioner, scholars, a dentist, a healthcare executive. So in the Senate, we have a cohort of senators who understand healthcare at a very deep level and who've been out, on the ground providing care to people who have been administering healthcare. And so what I'm doing is different. It is a very unconventional career, 25 years in medicine. And prior to the 25-year mark, probably at about year 15, started doing medical political leadership. And then in 2022 into big P political leadership here in Ottawa. So it's quite different, but I would say physicians, healthcare professionals would find the work that we do here not too different from learning in any healthcare profession, because your first few months, you feel like you were learning from a fire hose here in the Senate. And I remember feeling that same way in the first few months of medical school. There's so much information. It's coming at you so fast. You just don't even know how you're going to take it all in, but you do.
Oof.
And so a lot of that experience, plus our ability to analyze a lot of information quickly, critically think about it, make good decisions based on the information that you have. All skills you learn in healthcare, all skills that I find very applicable to the work that I'm doing now.
Well, I mean, I love it. I'm going to challenge you. I'm not going to be the kind of hostess who completely 100% agrees, because I agree that you're doing it differently. But if everybody remembers, I'm a public health doctor. Right. And so, and a public health doctor, the way we look at things is we look at a whole population and we think about how can we be part of creating policies that make people healthy. And I would argue that this is part of health caring differently, because where we live, work, play, those are things that, impact people's health, arguably more than a prescription. But it's nice where in our journey, we can do all of those different things. And so you've been in the operating room, but now it's a Senate room floor. And can you kind of speak to some of the work that, and it doesn't have to be in this role, but in your roles, you have been part of that big L leadership that starts with a smaller L leadership that really has to do with making society and patients do have better outcomes. Is that fair? Can I challenge you there?
Oh, and you know what? You're not challenging me. And I'm going to pick up on your public health background and tie that to a little bit of the work that I'm doing now to insert that health lens on the policies and legislation and studies that we do here in the Senate and we look at. And Dr. O, you are familiar with a health in all policies approach.
Yeah.
Correct?
Yes, I am.
Okay, so I'm going to put you on the spot because you're much more the expert. Could you explain to the audience what is a health in all policies approach?
Yes. So a health in all policies approach is understanding kind of like what I just described before, that what we decide to do as a society with regards to our schools, our workplaces, our traffic laws, or anything has health implications. So it really is a way of demanding that policymakers or politicians or people in Senate keep a health lens when they make decisions. So for instance, if somebody is going to make a, legislation on speed limits, that they would be thinking about the health implications. If we're going to make legislation on buildings or anything like that, or urban design, thinking about the health of the communities and how people will be impacted by that. Or even for students in schools, what they'll be learning and how their day is structured. How does that impact the health of students and everyday folks? So it's really thinking about health in every big decision and little decision that policymakers make.
And so my understanding, and you would know about this being in public health, but my understanding is in Canada, across municipal, provincial, and certainly federal government, there's no government that has incorporated a health in all policies approach. Maybe I've heard there's a province in Australia that might,
No,
but
Quebec.
at a provincial level,
Hmm?
is it formalized?
It is, yeah, it is formalized, but I'm not,
Yeah.
I can't speak to how well it's been implemented. But
Yeah.
it's the only province where it was formalized. But I don't know, yeah, how you know what I mean? The real life of how that.
Oh, yeah. So, okay, stick with me and I'll lead us back to our discussion. In the federal government, there is an analysis called a GBA plus analysis. That GBA plus stands for Gender-Based Analysis Plus to look at other intersections. It used to just be called a GBA analysis, so a gender-based analysis, but they've expanded that to be more inclusive, to include all of the other intersections. So the federal government actually has a tool, a lens that is supposed to be applied to every policy, every piece of legislation, where a gender-based a GBA plus analysis is conducted to examine if policies and legislation will impact positively, negatively on all of those intersections. So that got me, I'm thinking, why not health? Why not apply a health lens? So I've kind of started to ask questions. There is no standardized health lens that is used in the federal government, such as a health in all policies approach. And this is where the benefit of diversity, and this is my plug for the Senate of Canada, in the Red Chamber, there's more diversity in all of its aspects than in the House of Commons. So Senate of Canada, we're appointed. House of Commons, elected. So in the Senate of Canada, we have reached equal, if not a little bit more, women compared to men. We have more Indigenous representation in the Senate of Canada versus the House. We have not enough Black representation. I'll say that. Actually, in terms of the Black women that I work with in the Senate, fantastic, but still could do a little bit better. Other racialized groups, it's coming along. So there is a diversity, and not just in all of those, but diversity in sectoral experience, professional experience, leadership experience, such that we have senators who can approach legislation from all the different angles, which is what is the benefit of diversity. It's that cognitive diversity. Yes. And so, when we talk about healthcare, and if we just look at physicians in Canada, we still know there are groups of people who are underrepresented. Mm-hmm. And I believe, and I was just speaking to a colleague in terms of Indigenous physicians, at least in British Columbia, less than 1% of British Columbia's physicians are Indigenous. Yeah. And across the country, it may be a bit more, it depends on which data you look at. And I recall seeing some data from, I think, 2016, 2017. It was still low in terms of the percentage of people in Canada, so proportionally still low. Yeah. Which is why having different groups represented, you mentioned Filipino, I'm half Filipino, half East Indian. I am seeing more Filipino medical students across the country. They're starting to organize into support groups, to go upstream into high schools, to be representatives, to be role models, to show students who are in high school what they could strive for, what they could be. And that's that importance of representation. So I think that speaks to, at least in the role that I am in now, the importance of cognitive diversity and that diversity of experience and knowledge and skills.
Yes. No, I love it. And yes, there's so many pieces to this. First of all, shout out to the Filipino Medical Student Association,
Yeah.
right? For the fantastic work in just a short period of time, right? To like have really amplified and got things moving. Um, the fact that yes, health in all policies, bringing that lens that you have. This part of this conversation reminds me of when we had Dr. Everton Gooden, who also
Mhm.
right
Yeah,
served in ENT as well, I believe.
yeah. And
And
he's been an incredible role model in ENT, and an incredible leader.
an incredible leader and somebody who no longer is in the OR, but is in the boardroom
Yeah.
as the CEO of North York General Hospital, involved in change. Now you're involved in change at a like very high level, but there is a need for that health lens. There is that
Mhm.
need for that diversity lens that you spoke to. So there were so many things that were like just pearls that you just dropped. So I love it, just dropping that knowledge. And similar to what I did with Dr. Gooden, I think what I'm going to do is I'm also going to like rewind us back in time,
Mhm.
because I know we have students who are even just thinking about medicine or healthcare. And then we have some early medical students as well. And so we're going to rewind back in time for a moment. And because, I think when folks hear you and see you, they see the giant, really. You might not feel like a giant, but for us, every footstep you make is a path that we can follow. So certainly as a giant, but kind of going back to when you were that student, either thinking about medical school or had just started medical school, um, you know, were there some challenges that you experienced and had to overcome? So can you tell us about, any challenges to get into medical school or during medical school that you might remember?
Certainly there's always challenges. There's challenges getting in, and I've had conversations with medical students who've said, I've applied once, I've applied twice, I still haven't gotten in, I'm going to give up on my dream. And you probably know this from the conversations that you have. I think on average, I've been told it takes 3 tries before somebody gets in. So persistence is key, believing truly that's what you want to do, and overcoming imposter syndrome. So if
Mm.
anyone has felt like an imposter, and I have felt like an imposter many times, even today, sitting in the chamber, you're talking about legislation, and I feel like an imposter. I'm not a constitutional lawyer, but I can bring knowledge and expertise and skills that the constitutional lawyers can't. So think of it this way. Think of imposter syndrome as a social construct. So, an idea that has been constructed socioculturally by society at large. So, you feel like a square peg trying to fit into a round hole.
Yeah.
But who created that board? Who created that hole? Certainly no one that looked like me. Who set the criteria for what an ENT surgeon should look like?
Mhm.
Certainly not me. And so, a lot of our structures in medicine were created in a different time for different people. And the reality is, Canada is much different now. The people that we serve as healthcare professionals are much different, much more diverse than they were 50 years ago or 100 years ago.
Yes.
And so, getting rid of that imposter syndrome, feeling like you don't belong, is key, because there are many places in medicine, in society, that you might not look or feel like you fit in.
Yeah.
But were those structures designed to make you feel included, to make you feel like you should fit in? So, at the very least, you control what you can, and what you can control is your own mindset. So, instead of feeling like an imposter, and I've said this in different fora before, instead of saying, why me? Say, why not me? Why
Hey,
not me?
why not?
And really, truly work hard, believe in yourself, and hopefully in those medical schools, in that hospital, in that health authority, in that society, there will be others like you, Dr. O, who are working to change the system, to change those holes to maybe be bigger so that some of us square pegs can fit in. So honestly, I think for myself and honestly for a lot of other leaders I've spoken to, imposter syndrome is something sometimes even the most amazing people will admit to feeling in their lifetime as well.
No, absolutely. I'm so glad you shared that. And yeah, I believe that that piece that you said, right? Like instead of saying why me, it's why not, right?
Yeah.
And like if you don't see folks that look like you, it's probably a sign that you need to be there, you know? So that's so important. That being said, when we ask ourselves that question, I have to remind myself that as your host for tonight, I'm supposed to be the channel of sending other people's questions. So people do have questions for you, but I love the question we should ask ourselves, why not? Now we do have a question that's coming in. So folks, we have a hard stop tonight at 7:30. I know y'all like to ask your questions at the last minute, but we have a hard stop at 7:30. So I'm going to open up the Q&A and push for you folks to ask your questions. She's here for you. So we do have a question from Yursky, and thank you, Yursky. I've been noticing you like these last few weeks, so we appreciate you. Yursky is not shy. Yursky says, Dr. Osler, do you miss the operating room at all? Was it hard to say goodbye to it, assuming you don't operate right now?
I think that's a great question. And if you ask any surgeon, past or present, truly what is one of your most favorite places in the world to be, it's in the operating room. And one thing I want you all to know, it's not like Grey's Anatomy. It's not. As lovely as Grey's Anatomy may be as a fictionalized thing,
Right.
and it shouldn't be. So my ideal operating days would be truly a team environment. You know, we talk about team-based care a lot. And when you're in the operating room, and I have to tell you, as a surgeon, it is an incredible privilege. There's no other word for it. To have people trust you and trust the team to put them under anesthetic, do the surgery, and wake them up, and to look after them when they are truly at their most vulnerable. They're out under anesthetic, they're lying on an OR table, all they have is an OR gown, which has to be removed for parts of the procedure, and so they are left absolutely helpless. And so that is a privilege never ever take for granted. And when that OR team works together, and I say team because high quality, safe patient care, especially in an operating room environment, does not happen when you've got a surgeon who's acting like a diva, throwing instruments, not allowing folks to speak up if they have a concern about safety, if they have a concern about something. And so when it's all working well and the team feels empowered to look after the patient that they've been entrusted to look after, and by team, I mean everybody on the team, everybody in the staff who clean the room, the staff who bring you the equipment, the nurses, your circulating nurse, your scrub nurse, your anesthesia staff, your residents, your interns, everybody has to feel like they are pulling together, working together. And if there's a concern, they have to feel safe enough that they can bring it up. And when things are going well as a surgeon, you get into this state, and it's often called flow. Athletes talk about it. Surgeons can, you feel it, where you're so focused and concentrating on the task at hand, on the surgery at hand, yet you're hearing the OR machines beep. So you can kind of get an idea how things are going. You hear the heart rate, you can hear when the sats are dropping. You're hearing the chatter that's going on, but at the same time, you can focus on the task at hand. Those days fly by like that. Like you may have spent the entire day on your feet, but you do not feel like the day dragged on. And so that truly is part of the operating room, that if you're a surgeon and you're not there anymore, that is something I hope surgeons will say that they miss, because that is everybody coming together, working together in the best interests of the patient that they've been entrusted to look after.
I love that. That's beautiful. And the team and the flow. Like, I really love how you describe that. Like, I was in the operating room with you as you know what I mean? And
Mhm.
saying goodbye to that, somebody lent me, no, gave me a book. I can't remember the name of the author, but it was really being clear about your no and your yes. And so
Mhm.
sometimes you have to let go of something in your career or your life because you have a greater yes and a greater
Yeah.
calling. So it's not that you want to say no to that thing, but to follow the greater yes, you have
Yeah.
to let some things, that close that chapter, right?
And
And
that's a beautiful way to put it.
it just sounds like that's what you've done, right? You had a greater yes that you had to pursue. Now, as a greater yes, I know that you have, as a leader, and we're talking about leadership and the commitment that you've made in this new role. That you have a hard stop at 7:30, so we have 5 more minutes. So I know y'all like to ask questions at the last minute. Dr. Osler, it's kind of like when we're in clinic and it's just as
Yeah.
the patient touches the doorknob. That's where the questions come in. Like, oh, I had chest pain yesterday, by the way, but.
Yeah. And Dr. O, that's one thing for the students on the call or the would-be students. Um, and that's part of what all of our colleagues are faced with right now is just everyone is so tight and overbooked and short for time because the demand is so high. But it is how do you as a clinician make time and space for that person with the hand on the doorknob who may have been scared to bring it up and ask you a question. But it is trying to find space and the grace to hear them out, especially if it's a question like, oh yeah, yesterday I had this crushing chest pain, you have to be able to stop and listen and take that in because as you said, sometimes people hold things in until, you know, what may seem like the last minute, but for them was the right minute to ask certain questions. But in this case, yeah, you guys got to ask questions because I got to go
Yeah,
to
no, in
leave.
this case, you do have to go. And that's sometimes, let's get back to a clinical scenario. Sometimes there's another patient waiting and you don't want to, you know what I mean? So you
Yeah.
have to find that balance. It's in finding that balance. And one way that I know that you've been finding the balance, Dr. Osler, is I've been seeing you on the gram, on Instagram, and like engaging folks. So yes, today might have to go, but I think people can follow you or things like that. And I believe you're on LinkedIn and on Instagram and things like that. People can search and engage. You're a public figure in that sense.
Yeah, and I am not like you, staying up to date on social media. There's always so much going on here with work that occasionally you'll see me post something, but then I might not post for another week or two. And in my new role here, I'm trying to find a way to post um, information related to the work that I'm doing that is somewhat engaging,
Yeah,
hopefully not cringy, but also educational.
yeah.
And sometimes I do it, sometimes it misses, sometimes it's boring, but it's just trying to find that right way to communicate with people. And it's hard because it's short form.
Yeah.
But how to talk about some of the work that I'm doing here and relate it back to everyday people.
Yeah, no, absolutely. And I think it's fantastic. And not too many physicians in Canada are doing that. So even those there's a couple in Senate and I don't see them on Instagram. So I appreciate the work that you're doing there. So folks, if we have 2 more minutes, but if there are, things that you want to see about how, Dr. Osler does her work, then you can follow on Instagram and kind of see some of that, like today we did this and,
Mhm.
some fun things that you post. So we appreciate you. Now, I'm mindful of time. We have 1 minute left. So I want to know if there's anything else that you want to say and any other words of advice. You've given plenty. You've been like just dropping like pure knowledge, just pearls, pearls. But if there's anything else that you want to say before you have to go to our students, future doctors, nurses, leaders.
Medicine is an incredible profession. It is a caregiving profession, so it often attracts people who are not only intelligent, but often people who are caregivers with a deep, deep sense of empathy. And When you go into medicine, you will find there's a lot of work coming at you. There's a lot that you need to learn. There's a lot of skills that you need to learn. So you have to find ways to, how do you manage your time? And depending on the stage that you're at, whether you're applying to medical school or applying for residency or applying for fellowship or applying for a job, how do you stay up to date on everything that you need to stay up to date on to get the marks, to do the research projects? And yet, how do you still find time to honor who you are as a person, honor your uniqueness? That should make you really the best version of yourself. And so it is, how do you find that can be really, really tricky. One thing that I think is really important is to think about your support system. Who are your supports? Who are the people that know you for you? And it doesn't have to be a huge group, but is it family? Is it a close group of friends? Who will be there to help support you through some of the hardest times? Because there are, exams are a hard time. Interviewing for residency is a hard time. Your fellowship exams are a hard time. So who do you have as your support system that can be there to help you through some of those tough times? Make sure you don't neglect your support system, your friends, your family, because a lot of times in a medical career, you're so busy studying and you're so busy working in the hospital that you neglect that support system. And then when you need them, they may be too distant for you to call on.
I love that. I love that. And that is so important. Keeping, track of what's important and being true to ourselves and keeping those who love us and that we love close by. So thank you for that. I recognize that we are 1 minute over, so I don't want to take away from your time and the leadership work that you have to do. But thank you for joining us. And I'll stay on a couple of minutes in case you have other questions. But thank you so much.
Thank you, Dr. O.
Thank you, Dr. Osler. Okay, y'all. So I hope that you really enjoyed that. I certainly did. It is, it's a different path when somebody decides to go from the operating room into Senate, and it's just a really fantastic journey. So I'm really glad that Dr. Osler was able to make the time to speak with us today. It looks like some of y'all were a little shy, but that's okay. We will, in our newsletter, we'll let you know how you can follow Dr. Gigi Osler on Instagram. And I will now just I'm not seeing any more questions, so we're going to conclude, I think, especially since also one of our previous guests, Dr. Chika Oriwa, she was our second guest on the show, is having her book launch today. So I'm actually going to head over there. But again, congratulations to Dr. Chika Oriwa, who just wrote her book. Actually, I have it here before I leave. So unlike the rest, I just got it from Amazon today, and I'm going to go to the book launch. So that being said, I am going to thank, again, Dr. Gigi Osler for joining us today, and let you know that next week's guest will be Dr. Duarte. Oh, there's Dr. Chika's book up there. That's lovely. And so that's Dr. Chika Oriwa's book, Unlike the Rest. And so for next week, I'm going to have as a guest Dr. Duarte Adigbite, who will be joining us on the topic of BIPOC women's health and entrepreneurship. Thank you so much for watching. Please follow us on social media, and I'll see you same time, same place next week.